Okay, we're going to start by ACE wrapping a below the knee amputee patient. We want to use 4-inch ACE wraps, and you may need 3 or 4 of these wraps to ensure that you have complete coverage over the entire limb. We want to start right above the knee at the top of the thigh and loosely wrap around the thigh, and this will be your anchor point. After you've gone around, then you want to start down diagonally to the end of the limb, giving it a little bit of a pull so that you have distal pressure. You want to continue wrapping all the way around the limb and continue your figure eights and ensure that you have distal pressure more than proximal pressure. We want to wrap in a figure eight pattern to avoid strangulation to the tissue and any unwanted wounds. You want to make sure that you get slight overlap with each turn. And no wrinkles in the ACE bandage. When you have finished, you'll just secure it with the Velcro. And then you want to check the top, sides, back, and bottom of the limb so that you have complete coverage. Okay, next we're going to wrap an above the knee amputation patient. For this one, you'll use a 6-inch ACE wrap instead of the 4. You're going to start around the waist. The way the mannequin is here, we only have half of a waist, but you would wrap the whole way around their waist to start. And then that will be your anchor. When you start your diagonals, it's the same as with the below the knee. You want to wrap diagonally in a figure eight with distal pressure. And again, you may need to use multiple ACE wraps to complete this. Once you go around the waist, you don't go around it again, you just continue on the limb itself. And again, you want slight overlap with as little wrinkles as possible. When you're finished, you'll just stick the ACE wrap to itself, and then you want to again inspect the limb for complete coverage and no wrinkles. Just some extra reminders are that whether it's an above the knee or a below the knee amputation patient, you want to visually inspect the skin at least 3 times a day. When the patient is at rest in bed or in the chair, they never want to put any pillows underneath the limb to avoid contracture. And finally, the patient and their family need to be able to return demonstrate this wrapping because they will need to do it at home. The nurse in charge of the patient is more than welcome to seek out therapy if they need any assistance, and it is vitally important that the family and the patient do a return demonstration before discharge.